Hello, West Michigan. You are watching Alive and Well. I'm Linda Balkema, and today we are here at the Mercy Health Healthcare Enrollment Center. The Healthcare Enrollment Center is located at the Mercy Health General Campus, 1700 Oak Avenue in Muskegon. This wonderful new center is here to help people like you enroll in healthcare coverage under the new Affordable Care Act requirements. Today we will be having a grand opening, and we're going to talk all about how you can come in and enroll for healthcare. I do want to let you know that the center here is open Monday and Friday from 9 a.m. to 5 p.m. and on Wednesdays from 11 a.m. to 7 p.m.
Good afternoon, everyone. Welcome. I am Michael Grant. I am the Regional Director of Patient Financial Services for Mercy Health. And I also serve as the Regional Director of Patient Financial Services for CHE Trinity Health's Western Michigan and Indiana region. And I've also had the honor this past year, as we have ramped up for the Affordable Care Act, to serve CHE Trinity as the lead for consumer assistance. And part of that has been because of the work that we have done here in Western Michigan and specifically in Muskegon. We worked very closely with the Community Health Project and Vondi. Vondi has been one of my peers on the Trinity team that we've been working to model what we've done in Muskegon across our system. And so this is pretty exciting. The opening of this center really puts an exclamation point on the work that we've been doing, the collaboration that goes on in this community, and it really does serve as a model for other communities and other regional health ministries within our CHE Trinity system to follow. So this is pretty exciting stuff for all of us. So the opening of the Health Enrollment Center, as I said, just puts an exclamation point on the work that we've been doing. So welcome to Mercy Health's Healthcare Enrollment Center. The hours of operation currently are Mondays and Fridays from 9 to 5 and Wednesdays from 11 a.m. to 7 p.m. The center actually opened December 9th, and so we have already been reaching out to customers and patients, and I think there have been several that have already enrolled. We actually are live with an individual working through the enrollment center as we speak, and this was unplanned and unrehearsed. So, but it's pretty cool to know that we are up and running and active and reaching out to our community to ensure that people can get coverage and then receive the health care. We will have trained staff on site to assist consumers as they go through the process. I'm sure everyone has heard through the media, there have been a lot of bumps along this road. But having trained individuals that can sit down with people side by side, walk them through the process, assist them, and answer their questions. Again, it's a great benefit and a great service that we as Mercy Health are providing to our community. So with this, I'm going to also give special thanks to Maria Gonzalez from Senator Hansen's office. We're happy to have you with us here today. Thank you. And now I'd like to invite Pastor Eric Stratton to come up and offer a blessing on this center as we open. Pastor.
Thank you. I work full-time for a church called Bridge Bible Church, and I'm also part of the on-call team for the spiritual care services here. And between Hackley and Mercy, when they were separate as well as now as when they're together, I've been doing this for a bunch of years, and it's been a lot of fun. So I invite you to pray with me as we think about the idea of commending this center to God's service to the community. Let's pray. Lord God, we are broken people. Not only are we broken, but we recognize that in our brokenness, one of the ways that needs are met is through the kindness of others. A word, a gift, a loving touch, the sharing of information, the provision of services by professionals, including but certainly not limited to medical care. And I thank you that in your providence you have generously provided for this center and these people to serve the greater community with respect to helping them to access the health care to which they're legally and morally entitled. We are grateful for this opportunity to see this place open and to serve customers. And ultimately, we give you thanks because the second that we think that we are owed anything, that we can sustain our own lives or our own health, we are remiss. And so we acknowledge your kindness to us today, and we appreciate your generosity in this place. May it serve the community well, and we dedicate this facility and all who serve it, all who benefit by its services to you. We pray these things with thanksgiving. Amen. Thank you.
Thank you, Pastor.
Yeah.
Well, again, this opening of this center is one that is a lot of work that goes on. It's a great community partnership, as I mentioned before. It's also the result of great leadership. And it's now my privilege to introduce the CEO and president of Mercy Health, Greg Loomis, Mercy Health Muskegon, Greg Loomis. And it really is an honor. Greg has served in the community and here in a leadership role for over 34 years. I recently, it's been within the last year, Greg and I were at a dinner and we learned that we have a very similar history. Greg was a Navy corpsman, and he also served as a Navy corpsman with the Marines. I did as well. And back in the old days, you might remember that the Marines had a saying, they were looking for a few good men. Well, the Navy corpsmen had a saying that they found their few good men, and it was Navy corpsmen. So at this point, I'd like to introduce and turn the mic over to a good man and a great leader, Mr. Greg Loomis. Thank you.
Thank you. Thank you, Michael, and thank you all for being here today. This is an exciting day. It's open enrollment time for a group of people who really need open enrollment. We use that term. Those of us who have been fortunate to work for organizations that have good health care, we always talk every year we have open enrollment for health insurance. And you can even come to take that for granted. But I feel so good that finally we have open enrollment for another group. That's the way I like to look at this. And I'd like to just remind everyone of the mission of our organization. Our mission statement says that we, Trinity Health, CHE Trinity, and Mercy Health, we serve together in the spirit of the gospel as a compassionate and transforming healing presence in our communities, within our communities. Now, you cannot have that as your mission statement and not feel very good about what's going on in this enrollment center. This is great. No matter what your perspective is of the Affordable Care Act or anything else, you cannot deny that people who have just not been able to have access to insurance, being able to come into a place like this and gaining access is just a great thing. So I feel very good about that. I am often in my role, I'm asked about healthcare reform. And of course, this is certainly about healthcare reform. This is one of the best things of healthcare reform. And I'm asked, how is Mercy Health Muskegon prepared, or what are the impacts? And I always tell people there will be many challenges. Honestly, healthcare reform fundamentally changes much of the way we do our work, but not all in a bad way. But I let people know, we are well positioned to not only survive, but to thrive in this future world. And so I always talk about four things. And I won't go, this is not a lecture on healthcare reform, but I just want you to know that what I tell people is, first off, our hospitals are prepared. We are preparing our hospitals to be efficient and to provide high-quality health care as we have in the past, but even more so in the future. So the hospital piece is a key component. I also point out that our primary care physicians, our primary care network, provides high-quality service in a model called patient-centered medical homes. And this is all about preparing for our future with healthcare reform, providing service that is not just the physician and the patient, but a whole team of providers that is focused on helping people stay healthy, manage their chronic illnesses better, and honestly, when you're healthy, you're staying out of the hospitals. But that's part of what we're trying to help people do. The third thing I point out is our health networks. Lakeshore Health Network, which is a network of not just, it's a physician hospital organization where our physicians and our hospital work together as a team. So those are the first three things I talk about. But then there's always, the last thing I talk about is where we're standing today. The work of the Health Project and the work that's being done in this enrollment center now. I'll be able to talk about this. But that, for me, is every bit as important as anything we're ever going to do with bricks and mortar. That's about meeting the people who need health care the most where they need it. Knocking on doors. I am so proud of the Health Project and now this enrollment center. This is where the action is from my perspective right now with health care reform. So I always let people know that it's one of the things I am most excited about. So that I hope that fulfills the definition of a keynote address here today. But we are very excited about this center. I had a chance to visit this place the other day and actually see some of the details on how this all works. And this is the truth. I just left the hospital coming over here. And on the way out, I was talking to somebody. I looked at my watch. I said, well, I have to get over to Muskegon General because we're having a dedication for the enrollment center. And this person said, oh, I know about that. I was just there yesterday with my sister, and they gave her great help. So what a nice story on the way over. So with that, again, I want to thank Michael and his team for the great work putting this together and for all of you for being here today. So thank you.
Why Not Embroidery, located at 200 Holton Road in North Muskegon, specializing in custom embroidery and screen printing for schools, churches, corporate and fundraising events, family reunions, whatever the need or occasion. Featuring Lake Michigan unsalted apparel, Why Not offers sweatshirts, t-shirts, athletic and corporate wear, towels, backpacks, baby items, and graduation gifts. They also do window decals and signed vinyl. Why Not Embroidery, 231-744-8849.
Whether you're a first-time jewelry browser looking for an extraordinary engagement ring, a couple celebrating your 60th anniversary, or you're just looking to treat yourself or mark an important event, Prothheim & Swanson Gemworks is proud to offer custom-made selections handcrafted in America. Silver, fine-colored gems, diamonds, and gold jewelry, as well as strands of lustrous quality pearls. From ring and watch appraisals to in-house jewelry design and repair, ring sizing, remounting, to a complete rebuilding, you can rely on them to keep your old favorites looking new. K&S Gemworks, Muskegon's community jeweler. Memories made one at a time.
Camp Bell's Automotive and Towing, 24-hour towing and repair shop, all in one, specializing in foreign cars, as well as complete diagnostic for late models. Camp Bell's offers half-off towing if your vehicle is serviced there. If your car won't start or you need a fix, call 722-2796. Camp Bell's Automotive and Towing.
Benson's Drug Company, the home of Benson's Bottom Pain. Offering an expanded grocery selection, Medicare billing, and diabetes management and education. Benson's now features a Kodak machine, which allows customers to edit, copy, and develop their own photos.
Northway Lanes and Billiards, featuring Cosmic Bowling, 50 auto-score lanes, automated bumpers, 8 Brunswick pool tables, snack shop, and banquet facilities. With over 100 leagues to choose from, it's Northway Lanes and Billiards.
It is my pleasure to now introduce one of our first consumers who came in here to the Enrollment Center, and she came during a time when the system was very slow. It was, I think, the week before Christmas, and everybody was on there trying to get their health care enrollment, and she was patient. She had just had knee surgery. She hobbled in here, I thought, on the iciest day of the year. I don't know why she hobbled in here, but she was passionate about getting health care. And so Miss Elyse Savage, come on up, and she's going to give us a testimony to how this worked.
Thank you very much. Thank you, Linda. To Mr. Loomis, to Mr. Grant and his team, and to Linda Balkema and her team, and I just met Carol. I am so excited, and what an honor it is. I was frantic. I had saw the commercials, heard all the bad stories, and I'm thinking, I'm not going to try this on my own, even though I'm computer literate or what have you. And I called and I got this wonderful lady who calmed me. Linda right away calmed me. I came in here, it was the iciest day, I was on crutches, and she just made me feel so calm, so welcome. She led me through. We did run a snag because it was busy, but she gave me what I needed to go home. And so I went home that Friday night, and on my laptop, I went through. It was a breeze. I set up my username, my password, just as she had shown me. And I went through there, and I enrolled in insurance that I had not had since October 2011 when I lost my job. My boss passed away unexpectedly, and I was out of work, and I was accustomed to being covered by the employer. And I tell you, I have my cards. Here they are. They're absolutely fantastic. I feel a weight lifted, but I'm so thankful for this healthcare enrollment center because really out there, it's a terror if you don't know. And this is a safe haven to come to where they can lead and they can guide you and give you comfort and show you. It was a real blessing for me. It worked out wonderfully for me. I am thrilled to be a part to say, hey, this is something that's much needed in this area. I thank you so much. I could go on about this. I really could. I'm so excited. Thank you very much. Thank you, Healthcare Enrollment Center.
Hello, I'm Sharon Hull, Manager of Patient Registration at the Mercy Campus and the Financial Counseling Group. Thank you for joining us today. I do want to give a special thanks to Linda Balkema. She did do a lot of work and a lot of time and effort of getting the Healthcare Enrollment Center open for us on time and planning of this event. Even though our visits to the center have been low at this time, we're really hoping if we continue to work to inform the community that they will take interest in coming and getting the help that they may need. We'll be placing various cards in the community and within the departments of Mercy Health. We have already put out cards to such areas as the EDs, registration, financial counseling, Village at the Lakes, pharmacies, Lakeshore Health Network, that's our physician group. And there will be other places that we need to get those out too. We're currently looking at canvassing, hopefully some small employers in the area with the hopes of that is where some of the uninsured people are that are employed, and hopefully they will take part of coming to the enrollment center to see if they're eligible for any type of coverage. With the open enrollment also coming in April with the Medicaid Expansion, they're talking about 300,000 to 500,000 people out there that will be eligible for this coverage. So we're really hoping that they will take the opportunity to come and get the help that they need to get enrolled to have coverage through that Medicaid Expansion program. If everybody could please take the opportunity to get out the word that we are here, we are open. There are cards on the back table there that give our days, hours. Hopefully, if we can get that out there, that they will come. Well, you know, you build it, they will come. So hopefully that is the direction we'll go in. Thanks again for coming. Remember, our mission is to help improve the health care and welfare of our community, and we hope that our efforts will pay off. Thank you and have a great evening.
Dig in. You're watching Alive and Well. I'm Linda Balkema, and we are at the Mercy Health Healthcare Enrollment Center, where they just had a grand opening. With me is Sharon Hull and Jackie Britzen from the Financial Counseling Department at Mercy Health. Actually, I should know Sharon's title. She's my boss. Okay, Sharon, your title is manager. Let's talk about what was the reasoning behind opening this Healthcare Enrollment Center?
The need in the community. We have a heavy population of uninsured. It's part of our mission to provide services to our community. The need was there, so and our staff was trained and ready to help. So.
Yeah, well, I know that there's thousands of people in Michigan that need health care coverage, and I think for the first time, there's many people that have never had health care coverage in the past that are now eligible to get it under this new Affordable Care Act. Jackie, tell me a little bit about your experience in helping people enroll in the Affordable Care Act, and what is it that they call the Affordable Care Act?
Well, it has actually goes by a few different names, but most commonly Obamacare. It's the healthcare reform, the Affordable Care Act, and we've really had some great stories here. We've identified patients who actually have never had insurance before, and now they qualify for health insurance at very low, affordable premiums that they can afford. They have health insurance, and they've been very happy with. We've identified other people in the community that will qualify for Medicaid under the new expansion. Okay. So.
Yes, and I know the Medicaid expansion is set to happen in April. And Sharon, do you know a little bit more about this expansion?
I do know that they are estimating 300,000 to 500,000 people in Michigan alone that would qualify for some type of coverage through the Medicaid expansion. It is a little different than the basic Medicaid. There may be some premiums involved, some co-pays, but we're thinking that majority of our community would be eligible, and hopefully they come in and enroll. Yeah. And our center's here to help them. So.
Okay. Well, I know also under that Medicaid expansion, there's some big differences between current Medicaid and what the new Medicaid program, which I believe is called Healthy Plan of Michigan, that should start on or around April 1st. And Jackie, can you tell me what some of the differences are?
Sure. One of the biggest changes, I think, is in the criteria, where before you had to be under 21, over 65, disabled, pregnant, or have children in the home. With that, the criteria has been expanded to include low income levels as well. Individuals or family who meet the poverty level under 133% now will be eligible for the Medicaid expansion, and that includes singles. It's approximately under 15,000, and for a family of 4 would be right about 34,000. So it's going to include a lot more families and individuals that have not been able to get insurance through the marketplace and have not been able to qualify for Medicaid benefits in the past.
Yes, that's where these huge numbers of 300 to 400 or even 500,000 people in Michigan now are going to be eligible under the Healthy Michigan Plan. Also, I know all of those people that were on what we call Muskegon Care or the Adult Benefit Waiver, ABW. I understand that they're now all going to be eligible, correct?
Correct. They, from what we heard from the state, they will roll those patients over into that new plan. Okay. So, yep, and they will be covered.
They're going to be getting notices, is that correct?
From what I understand, there will be a notice that goes out to the Muskegon Care patients or Adult Benefit Waiver Program in February. But at this time, they're saying that there's nothing that they need to do for the transition. They will automatically be transferred to the new program.
Oh, that's good to know. Okay, well, that's something else about the Healthcare Enrollment Center. We do plan to continue having it open beyond the end date of the marketplace insurance, which we know that there's a March 31st. You're supposed to get in here and enroll in a plan by March 31st. And a lot of people are really worried about this and afraid of it, but with these wonderful subsidies, I have seen plans as low as $0. There's also been some $14 plans, some $40 plans. I mean, they're very affordable. And Sharon, maybe you could elaborate a little bit about people paying for health care coverage or adjusting to that. You know what I'm talking, well, okay, it's supposed to be like paying a cell phone bill. We're just not used to paying for health care. And that's something that we all have to adjust to, I think, is paying for health care.
Correct. I mean, there are the premium tax credits out there that the federal government is supplying. And we've seen with some of our enrollees that is a pretty big credit to give towards your premiums. Right. I think, though, with the price of health care alone and being uninsured, it makes sense to be covered, especially if you have a family, have young children. It's just a different atmosphere for some people. They have to put it into their budget. And hopefully, they will benefit from having the coverage.
Sure. Well, it's a lot like they're used to paying car insurance. We've been paying car insurance for years, and you can probably get a plan if you qualify within a certain income limit and the subsidies that are involved. You can get a plan that might be even cheaper than your car insurance. So it's worth taking the time to come in and see how this works. I think a lot of people are confused when they get on the computer and try it themselves. They might be very computer savvy and not have access to a computer. They can come in here And then there's the trained staff. Everybody that does this has been trained on the entire program of the marketplace and the Medicaid expansion.
Absolutely.
Yeah. So Jackie, you had an experience today with a person doing that.
I did. And they had actually heard about the Enrollment Center from a friend who directed them to the Enrollment Center. It was somebody who actually hadn't had insurance in 4 years, and it turned out that he was going to qualify for the Medicaid expansion, which he didn't know anything about, and so he was very excited. Before he left, he said, "I'm not disappointed. I will be back in April to enroll, and I will tell everybody I know to come down to the center."
Yeah, so
he had a positive experience.
He did, and it could get pretty busy here come April. There are other places. Yes, that's what this center is here for, to help people enroll in health care coverage. If you need to apply for the marketplace, right now, people that are at 133% of the federal poverty level, and even though they may be eligible for the Medicaid expansion under the Healthy Michigan plan, they can also come in here and apply in the interim for an affordable plan. There are some affordable plans that can carry you over through those months until you qualify for that Healthy Michigan plan. And when we talked about that plan, you mentioned there's going to be some differences. Can you think of a couple of those differences that we've heard about Medicaid expansion?
Just the difference of having a premium to pay for the coverage. I know it has to kind of fall in line, I'm assuming, with the healthcare marketplace as far as, your income, your household size, things like that. And also, from what I know about the Medicaid expansion plan, they do plan on having like a health savings account to where you can put money into these funds to pay future co-pays and things like that. So it's not out of pocket at the time, unexpected. It's kind of a little savings to help you down the road to pay for your services.
And as I understand it, those people that are going to be paying in those health service accounts or what did we call it? Health savings accounts, that they are the ones that are between 100% and 133% of the federal poverty level, which would be for a single person between about $11,500 and $15,282, I think is the number. There's some room for adjusted gross income, but those people might have to pay about 2% of their income, so it's still very low, very affordable cost. And they're going to offer dental and vision, adult dental and vision, and that's news, and that's something that the Medicaid plan has not had for a long time, something that is very needed here. So please come on in and enroll in this plan. And Jackie, why don't you tell our viewers one more time about the hours of operation and the location?
Sure. It's the Mercy Health General Hospital campus. We're located at 1700 Oak Avenue. It's right off the lobby. We are here Monday and Friday, about 9 a.m. to 5 p.m. And Wednesday, we are here from 10 a.m. to 7 p.m. And you can always call for an appointment if you need to see somebody outside of those hours. And that phone number is 231-672-2711.
Okay, thank you very much. Well, thanks, and I think that will give our viewers a lot of good information, and we hope that you will come on in at the Mercy General campus and apply for your health care coverage. Thank you for watching.
For nearly 9 years, West Michigan Driving Academy has been providing Muskegon County with complete, comprehensive driver's education. Students spend time both in the classroom and on the road in a state-approved driver's education vehicle with state-certified instructors. West Michigan Driving Academy is the only school in Muskegon that offers both day and evening classes throughout the summer. Accident-free with 150 years of combined experience, you will drive safe at West Michigan Driving Academy.
The Trophy House and Jones Sports have been servicing the area for almost 50 years. We handle all team sports, uniforms, and equipment and have a full custom design service for your athletic and corporate logos. We have trophies, plaques, and awards for all occasions. We engrave, embroider, and do silk screening. We have stock t-shirts, sweatshirts, both hoodies and crews, sports shirts, jackets, and specialize in corporate promotional products. The Trophy House and Jones Sports, helping you promote you.
Sprague's Auto Parts offers used parts at big savings. Engines, transmissions, radiators, starters, windows, doors, fenders, tail lights, seats, you pull it. For more information, call 231-726-2988. Sprague's Auto Parts, 81 South Getty Street, Muskegon.
813, exit 15, and we're clear.
01 Armitage at the gas station. Stand by a second. All right, 10-4.
Fair representation at a reasonable price. Sean P. Davis, PLC, 1065 Peck Street, Muskegon, Michigan, www.seanpdavisplc.com.